So I'm Dr. Jim Karegeannes. I'm practicing out of the 129 McDowell Street office in Asheville. I mostly do joint replacement surgery, lower extremity joint replacement, hip and knee replacements. I remember in middle school I had a class where we had to learn the bones of the skeleton. I was playing football. I was out in the middle of nowhere in the back zone of the defensive team, going over in my head the different bones so I'd get them right. And once I was in medical school, thought I'd be a surgeon, good with my hands, always made things in my dad's garage. But my third year, just on a lark, I guess, I took an orthopedic class, and those guys were great. They had fun, they enjoyed their work. It seemed like a really good group of people, and that's when I decided to follow the training path that I did. So I specialize in hip and knee replacement surgery, which is, of course, a big volume now, growing every year as the population ages. Really interesting work. It works well with I think the mechanical skill set that I have, and I enjoy it. I have to say, it feels like you're creating something every time you put a new hip in a patient or a new knee in a patient. It's very rewarding work. So what's unique about Emerge is how we bring together people that we feel are well qualified. The CEO at our hospital recently remarked when we were putting one of our new partners up for privilege at the hospital, he looked at me and said, this guy's great. Well, I said, well, yeah, that's who we want to work with. And we have the model that lets those people, practice where they want to practice, and do the things they want to do, so we really we can specialize in the areas that we can really do a good job for, and that's what our patients want. They want it done right. They don't want to have problems, and they want to be, I think, proud of the person that they've chosen to help them with their care. Asheville provides care for the 1.5 million people that surround us in Western North Carolina. So I remember when I first came here 26 years ago that I would bump into people I trained with at Duke, and I'd say, what are you doing here? No, I'm with cardiology. What are you doing here? General surgeons, pulmonologists, infectious disease specialists. We had a good community of well-trained people here. I'd worked in other hospitals along the way. I had some time in the Navy after medical school, and so that put me around the country at different spots. But I found here was a medical center and a practice that I could do, the work that was a little more challenging, which is professionally very rewarding, but also great for the people who don't have to travel 4 hours to Durham and 5 hours to Charlottesville and 4 hours to Atlanta to get the care they need. So that's a big advantage of being in the Asheville area. What I like about Emerge is that it's run efficiently, it's run professionally. It evolved from a smaller model we had before the Emerge merger that led to the groups across the state joining up. We've always tried to be fair with how we deal with each other within the group. We've always tried to be grounded in the community. I think we have a level of quality in the people that are part of our practice, from the surgeons and to our staff, that's very appealing.